So maybe we can start with discussing a little bit about what is so important about physician health and professional health in general.
Being a physician, being a healthcare professional, you are situated as a carer for patients, and that's your direction. And especially for physicians, sometimes that's your primary priority. That's been the way the profession has been for many, many, many years. Being a doctor is an identity. It's self-sacrifice. It's a way of providing the best care to your patients. Your own health then becomes less of a priority or no priority. There are risks, and people need to know what those are, and safety things that they need to manage and skills that they need to acquire. Wouldn't it be kind of cool if day one that medical students heard there are risks here? These are the skills you need to acquire. These are the important pieces. This is why, and enjoy this, next 3-4 years of training. So for me, there's that component that we have to manage throughout the lifespan of a doctor, how these impact us, because we don't predict who's going to get sick, who's going to have trouble with a specific incident or a specific problem.
These days we hear a lot about the stress of medicine, medical practice. Can you tell me a bit more about that from your perspective?
Christina Maslow and other people have done an awful lot of good work looking at people employed in workplaces, not just healthcare professions, and looked at what are some of the criteria by which people start to be present in work, but really not present, presenteeism as they call it, or people who have frequent mental health days because they're not able to manage. They don't necessarily have a psychiatric disorder, but they're not thriving in their workplace. And what they came up with was this concept of burnout. And burnout is defined as a condition where you have emotional exhaustion. You have as in medicine, you start to see the other person as more distant. You're not as emotionally engaged with the other, which is quite distressing to experience. And the third point is you have you work really hard, but you're not getting personal satisfaction. You're not seeming to accomplish as much. So it's those three components that sort of make up the burnout picture. There have been lots of survey data looking at large populations, in particular with physicians, and the Mayo Clinic, Tate Shanafelt and his group have done some of the seminal work in that area. And what they're finding with American doctors is that around 46%, a mean, are showing significant signs of burnout. And the good part about this is that burnout is absolutely manageable. I don't want to say treatable because it's not a disorder, but there are many ways to help somebody perform better, to manage stress better, skills that they can learn. And so this is definitely reversible. One thing I'm grateful that the signal is right now so high in terms of burnout, because there are lots and lots of initiatives looking at kind of creative ways of managing burnout and stress. People who do cognitive behavioral therapy have sort of changed things to look more at stress reduction. Mindfulness meditation has definitely, I think, been groundbreaking in helping us learn how to manage stress in the moment and care for oneself in the moment in sort of a non-judgmental way. That's incredibly helpful. All the way to something of interest for me is what can we take from sports psychology, from people who perform at high levels, who are obviously able to manage stress and have a lot of skills to do so. So I think I'm hopeful that we can look to some changes both for the individual, but also that this will feed back to the institutions, because burnout also lives at work. And there are obviously things that workplaces can do to better appreciate and increase satisfaction of their employees.
So we've talked a bit about how health in the workplace and support from the workplace is so important. I'm interested to hear your thoughts on how those same principles apply to the training environment for students and residents.
The new things that have come out in the 2015 CanMeds is that physician health is actually on there. So part of being a professional, a healthcare professional, requires that you be aware and manage your health appropriately. So it's sort of embedded already now in the expectations. And as a result, medical schools and residency programs have sort of taken this, and they already have, and are starting to develop wellness programs, and so that there are places for students to go that are confidential, where when it is burnout, it can be early and managed very quickly. The same thing for residency programs. So I think that the ball is rolling in the right direction, where education is going to come from the educators of our medical students and our residents, which is where it ought to be, in a place where they're starting to understand the importance of this as a competency, and how are they going to ensure that their students, their learners, and their residents are well equipped to be able to manage whatever comes their way. So I think this is really actually quite exciting, and it marries well with the work that's been done now for 20, 30 years in the physician health field.